Pleura Explained, Body Cavities and Membranes. Imagine your chest as a well-organized space with layers of protection and support. Inside this space, the lungs need a smooth environment to move easily during breathing. That's where the pleura comes into play. The pleura is a double-layered membrane that surrounds each lung. It helps the lungs expand and contract without causing friction or damage. The outer layer of the pleura is called the parietal pleura. It lines the inside of the chest wall, the diaphragm, and the space between the lungs called the mediastinum. The inner layer is known as the visceral pleura. It covers the surface of the lungs and extends into the lung fissures, which are the natural separations between different parts of the lungs. These two layers are connected at the lung root, or hilum, forming a continuous membrane. Between these layers is a tiny space called the pleural cavity. This space isn't empty. It contains a small amount of clear, slippery fluid called pleural fluid. This fluid acts like a lubricant, allowing the two layers of the pleura to glide smoothly over each other as you breathe. It also creates surface tension that helps keep the lungs pressed against the chest wall, which is essential for normal breathing. The parietal pleura has different parts based on what it covers. The costal part lines the ribs and chest wall, helping to anchor the lungs. The diaphragmatic part covers the diaphragm, the muscle that helps you breathe. The mediastinal part lines the space in the middle of your chest that contains your heart, major blood vessels, and other structures. There is also a cervical part, which extends into the neck above the first rib. Within the pleural cavity, there are recesses or pockets called pleural recesses. These are spaces where the layers of the pleura come close but do not touch. The main recesses are the costodiaphragmatic recess, located between the diaphragm and the ribs, and the costomediastinal recess, between the mediastinum and the ribs. These areas are important because they can collect excess fluid, leading to a condition called pleural effusion. The negative pressure inside the pleural cavity is what keeps the lungs inflated. When you breathe in, your diaphragm and chest muscles expand the chest cavity. This expansion creates a vacuum that pulls the lungs outward, filling them with air. If air or fluid leaks into the pleural space, this negative pressure is lost, and the lung can collapse, a condition known as pneumothorax. Understanding the pleura and the pleural cavity helps explain how your lungs stay in place and move smoothly during breathing. It also highlights how issues like fluid buildup or air leaks can affect breathing and overall respiratory health. These membranes are small but mighty, making sure your lungs work efficiently within the chest.